Another issue that's resonating on the provincial election campaign trail is Ontario's shortage of family doctors. Some 2.5 million people do not have regular access to a family physician. And our senior Queen's Park reporter, Mike Crawley, is on this story for us. Mike, what are we seeing in terms of how important the family doctor situation is to voters?
Yeah, Chris, in my reporting over the past couple of years, looking at this issue, I've talked to a lot of people who don't have a family doctor, and there's basically no issue that is more important for them. Family doctors, your access to the healthcare system, right? And folks who don't have one, they're left, waiting long times in walk-in clinics or even having to rely on emergency rooms. I spoke to one such person, Louise Lee. She lives about half an hour from downtown Ottawa, and she spent the last 2 years looking for a family doctor to replace her longtime doctor after she announced her retirement. Take a listen.
Anyone who mentioned seeing a doctor, going to a doctor, we would say, are they taking patients? Could you ask on our behalf? We had people looking online for us. We were continually searching online to find places to add our name to wait lists.
So she told me that healthcare is one of her biggest concerns in this election, and the family doctor issue is going to influence, it's going to be a big factor in how she votes.
Yeah, so her story certainly lays out the problem well. Break down for us what each party is promising in terms of solutions here.
Okay, so we're going to start with the first party to actually put forward a detailed platform about family doctors. That's the Liberals. They did this back in December, saying that they would spend $3.1 billion over the next 4 years. Their promise is to add 3,100 family doctors to the system, and they say this would guarantee a family doctor for everyone in Ontario. Over to the NDP, they are also pitching their plan as a guarantee of a family doctor. They'd spend a little more than the Liberals, about $4 billion, and they would add 3,500 family doctors to the system. Now over to the PCs. Doug Ford's government actually waited until the day before he triggered the election to release its family doctors plan. Their proposal is $1.8 billion, so a little less than their rivals. They'd create a little more than 300 of what they're calling primary care teams, and the promise that they're making is to give everyone access to a primary health care provider. Finally, the Green Party has not released details of its plan, but has said that they're committed to connecting everyone to a primary care provider. So, Chris, those are the plans, a few notable differences between them.
And Mike, how much of a factor do we think that this will end up being in the race, given all the other topics that are of issue? Yeah,
look, in just about every provincial election you ever have, including this one, people say that healthcare is one of their top issues. But what we don't know is whether that actually shifts the vote and influences the results. The Ontario Medical Association is trying to make that happen. Here's its president.
Voters need to say to the candidates that they meet is, if you want to form government, you have to tackle healthcare and you have to get our healthcare system back on track. So I'm happy that candidates are speaking about family practice, about connecting everyone to a family doctor. What I'd say is, if you're a voter, you should be thinking about who do you trust to deliver on that promise.
The stats show that the age group that is least likely to have a family doctor is people aged 18 to 34. That's also the age group that's least likely to vote.
Mike Crawley, hot on the campaign trail again today. Thank you, Mike.